As this crisis worsens, health experts have repeatedly warned that our national response is just not enough. We are joined now by Health and Human Services Secretary, that's Alex Azar. Good morning to you, Mr. Secretary. Good to see you.
Good morning, Gail.
First, let's start with kudos to the Trump administration because Operation Warp Speed appears to be working the way you all had hoped. Let's start with Pfizer. Breaking news this morning that you've applied, the FDA is going to apply for emergency use authorization. What does that mean? How soon could the vaccine be available and to who?
Yeah, Gail, it means that hope and help are on the way. Pfizer filing today for emergency use authorization means that FDA will very quickly announce that we'll be scheduling a public advisory committee process of independent experts who will give FDA their best views on the data. And if the data is as solid as it appears, and if the company is transparent in their interactions, we literally could be weeks away from the authorization of a 95% effective vaccine. And we've said 24 hours later, we'll ship millions of doses of that vaccine, and within a couple of months between Pfizer and Moderna's vaccine, assuming they both are approved, we will have vaccinated tens of millions of America's most vulnerable citizens.
Okay, let's hang on to that, Secretary. But let's talk about your news conference yesterday. Number one, it's great to see you guys. We haven't seen you in 4 months. I'm curious about why it took you so long to come out and speak to the American people and let us know what's going on. And Deborah Birx pulled no punches. She said the numbers are going in the wrong direction. It's getting worse. What is happening here? Why can't we get it under control?
Well, the situation is very serious, but it's not one where the United States is isolated. We've seen this in Western Europe and Canada and the United States. I coordinate across all the G7 health ministers, and it's a common phenomenon. The people are fatigued. People have given up. They've sacrificed so much over the last 10 months. And as we've gotten colder weather, we've moved indoors, and we've lost that kind of natural social distancing that happens from being outside. And we've gotten into household gatherings of friends and family. We've gone to crowded indoor bars and restaurants, and we let our guard down, and we don't practice the 3 W's of washing our hands, watching our distance, and wearing our face coverings when we can't do those things. And that's what we have to do, and that's what can get this, so we can bend the curve, as Dr. Birx and Dr. Fauci said yesterday, if we'll all just do those things.
Yesterday, President-elect Joe Biden said that he's had no contact with the Trump administration. And this is a very dire situation, as you know. He says every day that they don't communicate, it's costing lives, because ultimately they're going to have to take control of this. When do you plan to speak to the Biden administration?
So we'll coordinate and talk as soon as it's appropriate. I'm going to leave that transition planning to other individuals. Right now, what people need to know is the coronavirus response. We're all on it. Operation Warp Speed.
But when is it appropriate?
Leading those efforts.
But wait a second, when is it appropriate?
Yeah.
Gail, go ahead.
Gail, there's a statute in place that directs a process for that. What the American people need to know is the same career people at CDC, FDA, Defense Department, HHS that are running this response in Operation Warp Speed on January 19th are going to be the same people on January 21st, and every aspect of what we do is completely transparent. There's no secret data or knowledge. We've spent hours literally with the public and the media this week laying out every aspect of the distribution planning on these vaccines, our epidemiological information, completely transparent, our planning, everything
so Secretary
is
Azar,
all out there.
It sounds like you're saying that that Joe Biden is incorrect when he says this delay is going to cost lives?
Absolutely incorrect.
All right. We'll leave it there.
All right, Secretary Azar, thank you. We have a difference of opinion, clearly, but we thank you for your time this morning.